In the bill, there is a safeguard which stipulates that the practitioner must reaffirm consent, which I assume includes assessing competency to consent immediately prior to administering the drug. Now, there is no such a safeguard when the drug is given as a prescription after the prescription is given. The patient can take the drug possibly years down the road, potentially with a mental illness progressing, and there is no one there to ensure that the individual has the capacity to consent, is being coerced, etc. So when the physician administers the drug, it is stipulated that a witness who is not a beneficiary of the patient must be present. However, virtually any individual can administer the drug to the patient after it is given as a prescription, and there is no provision barring a person who is a direct beneficiary to the death of the patient. This strikes me as a problem. Do you care to comment on why clearly I believe the intent was that nobody is supposed to benefit from somebody's death, and yet there is no safeguard that a beneficiary cannot administer the drug after it has been given by after the prescription has been given to the pharmacist and the pharmacist has given the patient the drug.
I guess one element would be to say that it would not be the beneficiary administering any drug, because you're talking about self-administration in that context. The only person who can actually administer a drug would be a health professional, and then you're in the other situation. I think the other thing I would comment on in the context of this, the issue of the reaffirmation, is this scenario, which is an individual who has met all of the criteria for access and all of the procedural safeguards have been met. They are receiving pain management because they're in extreme agony. And what this provision requires is that they be brought out of their sedated state, their pain brought back up while you wait for the pain meds to clear, such that you can decide that they're capable, such that you can get the reconfirmation. And can you imagine when you're brought back out into that pain state? And then, and that's what this requires, this provision. So that's what I would raise as a concern.
So you're okay with the beneficiary receiving or being able to help? There is no exemption for a person aiding a patient. No person commits an offense under paragraph 1B if they do anything at another person's explicit request for the purpose of aiding that other person to self-administer a substance. So aiding the person to self-administer the substance. So the beneficiary is aiding the person.
Yeah. So that was asked to Linda Ganzini, actually, earlier on in this whole process, quite a ways back. She's an expert researcher in Oregon, and this was at trial. And one of the things that she was commenting on in conversation with me afterwards was that it's a mischaracterization of what families are doing at this stage. Families are begging their loved ones not to go, not to have an assisted death, because they want to keep them around longer. So to frame it as if there are these people around who want to gain access to that wealth, where's the evidence for that? You look to Oregon, you look to the Netherlands, you look to Belgium. There isn't evidence of that. And so I think we have to be really, really careful about evidence-based policy making here.
People are murdering their parents. Had a case in Atlantic Canada, got convicted of beating his father to death. So people do want to get rid of their loved ones.
But then the violation would be in not having met the criteria. It would still be a crime.
Well, in this case, it
because it wasn't a voluntary act by the person.
No, that particular one wasn't. But what I'm saying is that there are. Right. You're suggesting there's no evidence that people don't want their loved ones or supposedly their family members to die because they are the beneficiary.
No.
We have hundreds of cases of that
in the context of requests for medical assistance in dying, there is no evidence of that.
Well, thank you.